In this video, we are going to talk about the key populations and how these key populations often face stigma, also in the healthcare system. In the next video, you will learn more about this.
People living with HIV sometimes experience fearful reaction when their status is known. People are afraid of becoming infected. As a result, people with HIV experience stigma, prejudice, or exclusion, even in healthcare. While this is completely unnecessary. Someone infected with HIV is usually treated. The amount of HIV in the blood then drops so significantly that is called a suppressed virus. At that point, a person can no longer sexually transmit HIV. We call this U equals U. Undetectable equals untransmittable. Even in cases of blood contact, such as needle stick injuries or wound care, there is no risk of transmission. The key factor in the HIV transmission is the viral load, the amount of HIV in the blood. With a low viral load, HIV cannot be transmitted. With a high viral load, transmission can occur, but the likelihood is small. Extra precautions are not necessary. Existing hygiene guidelines are sufficient for all patients, including those with HIV.
Can you name 5 key populations with an elevated risk of contracting HIV? The answer is individuals belonging to the LGBTQI+ community, ex-prisoners, people who inject drugs, and sex workers. When developing this training, we spoke with individuals from key populations who shared their experiences within the healthcare system. To give you an example, a young woman shared her story. She was using drugs and got pregnant. She went to the gynecologist for her first check and shared information about her drug use. She worried about the effects of the drugs on her child and wanted help to stop with drugs. The gynecologist, however, referred her for an abortion and told her she would not be a good mother because she was a drug user. Do you have prejudices regarding to key populations? Sometimes you may not be aware of your own prejudices towards key populations, which can unconsciously affect how you communicate with them. This can be painful for the individual and directly impact the trust between you and your patient. To improve your communication skills, the first step is becoming aware of these biases. So let's reflect by questioning yourself. Have you ever unconsciously used stigmatizing language? Thank you for participating in this video. By discussing the stigma faced by key populations in healthcare settings, we hope to shed light on the importance of self-reflection and communication in building trust with your patients. Recognizing and addressing our biases is crucial for providing compassionate and effective care. Stay tuned for the next video, where we will delve deeper into this important topic.